Hey guys, this is Dr. Brett Scott at Barbell Therapy and Performance. Something we're going to cover today is a question we get a lot in the field about foam rolling and breaking up scar tissue. So I just got something in asking if progressing from a white, softer foam roller to a firmer black foam roller to help break up more scar tissue in the IT band is a good idea. And this is really something that's a big mantra in the field still, that people think foam rolling is going to break up scar tissue, which really isn't the case. So as we know, we talk about surgeries and stuff, and people are like, well, the surgeon had to go in and break up scar tissue. And they're not using a foam roller to do that. They're using scalpels, scissors, knives, saws, whatever else it may be, to in fact break up scar tissue. So what we really need to know is that foam rolling can feel good, and it's not a bad idea to foam roll necessarily, but we are not breaking up scar tissue. So we have plenty of studies out there that show it takes about 2,000 to 4,000 pounds of pressure per square inch to in fact break up scar tissue. So laying on a foam roller with, even if you're a 200-pound male, is not going to break up scar tissue. But what we are doing is changing the input to the system. So our brain relies heavily on inputs and outputs. So what we feel is actually in our head. Just like if someone was an amputee patient, they can still have pain even though their leg might not be there. So we're getting input from that leg for whatever reason to give some sensation. So if we can in fact foam roll, we're changing the input to the system, and it doesn't have to be hard. Most of our mechanoreceptors are right on the surface, right under the skin, and we can affect those just as well with a very soft foam roller to improve the output or change the signal that might decrease the sensation of pain, because we've now given the body a new perception that it can tolerate more load. Now, the other thing here is that we didn't cause some buildup of scar tissue from not foam rolling. The body doesn't really do that. It might feel tight, it might feel tied down per se or something like that, but it might be the way you move. So if we're lacking stability or strength somewhere, or we're moving at a very high level of performance and we're not in the most optimal positions, we might have some issues there, but we can correct those without the use of a foam roller by just giving the body some feedback. We can even do a back bend and sometimes improve hip or IT band pain. So again, we can foam roll, but we don't need to do more than 30 seconds at a time. And softer is actually sometimes better. We don't want it to hurt, because then we're telling the body to protect itself again. So sometimes using the white foam roller is actually a better idea than trying to use one of the firmer ones, or one of these ones with all the big, the rumble rollers with all the knots and everything in it that can dig in really hard, because when the body starts to fight back, we're never really telling it to relax or calm down. And that's what we're actually trying to do with any type of soft tissue work, like massage or Graston technique, or foam rolling itself is another way to do that. So we necessarily don't need to do that, and we're not in fact breaking up scar tissue. We're simply just giving the brain a new novel stimulus, or input rather, to then change the output, and that's why we're going to feel better. And then we want to make sure that we always kind of end that with some type of new movement pattern, or honing in on a movement pattern, so that that new mobility can stick around a lot longer, much like hitting save on a Word document. So I hope that helps. If you guys have any questions, please let me know. Thanks.